Up first in the Senate as the upper chamber votes to confirm a new CDC director. The administration launches a health technology initiative. And Senate appropriators take new action for fiscal year 2026 funding. For the week of August 4th, 2025. From Capitol Hill in Washington, D.C., this is Health on the Hill, brought to you by Heart Health Strategies. I'm Matt Duckworth.
Good morning. The committee will come to order. Today, the committee will consider two more fiscal year 2026 appropriations bills, the defense legislation and the Labor, Health and Human Services, Education and Related Agencies bill.
Kicking off this week's episode with news from Capitol Hill, where the Senate passed the fiscal year 2026 Agriculture, Food and Drug Administration spending bill on Friday in an 87-9 vote as part of a minibus package with the Military Construction Veterans Affairs spending bill for fiscal year 2026. Under the legislation, the FDA would receive $7.1 billion in funding, roughly in line with fiscal year 2025 spending levels. The FY26 Labor, Health and Human Services spending bill was advanced by the Senate Appropriations Committee last week in a bipartisan 26-3 vote. The legislation totals $116.6 billion, a $446 million increase in discretionary funding over the current fiscal year. The bill increases funding for the National Institutes of Health by $400 million and maintains funding for the Centers for Disease Control and Prevention at current levels. The panel also advanced the fiscal year 2026 defense spending bill. Together, defense and Labor, Health and Human Services account for approximately 2/3 of federal discretionary spending. Across the Capitol in the House of Representatives, the chamber adjourned for August recess before releasing its fiscal year 2026 Labor, Health and Human Services Appropriations proposal. House appropriators are currently expected to consider the LHHS bill the first week after reconvening on September 2nd. Lawmakers will return from their August recess next month with about 4 weeks to pass legislation to avoid a government shutdown. Without a broader government funding deal, there's a strong likelihood that Congress passes a short-term continuing resolution to extend funding for the federal government beyond the deadline of September 30th.
Chairman Cassidy, Ranking Member Sanders, and members of this committee, I am humbled to be here today before you, and I am honored to be nominated by the President to be the Director of the Centers for Disease Control and Prevention. I am joined by my friends.
That was the voice of Susan Monarez, the new Director of the Centers for Disease Control and Prevention, who on Tuesday received a 51-47 vote on her confirmation to that position. Monarez has worked in the federal government for 2 decades, most recently serving as the acting director of the CDC after working as the Deputy Director of the Advanced Research Projects Agency for Health, or ARPA-H. During the first Trump administration, she served as Deputy Assistant Secretary for Strategy and Analysis at the Department of Homeland Security. Monarez, who has a PhD in microbiology, is the first person without a medical degree to lead the CDC since 1953. She's also the first Senate-confirmed CDC director, following a statutory change made in 2022, requiring approval of the CDC director by the Senate.
Today, the committee is considering multiple bipartisan pro-worker, pro-family, and pro-patient bills, strengthening Americans' access to quality health care and retirement benefits. I really appreciate colleagues working on these bills.
Last Wednesday, the Senate Health, Education, Labor, and Pensions, or HELP Committee, held a markup of several health-related bills. The panel advanced the following bills unanimously via an unblock vote. The over-the-counter monograph drug user fee amendments to reauthorize the Food and Drug Administration's authority to collect industry fees and review over-the-counter drugs through October 1st of 2030. the Improving Care in Rural America Reauthorization Act to reauthorize 3 grant programs for preventive screenings, telehealth services, and chronic disease management for underserved populations through 2030. The K-Hagen Tick Reauthorization Act to reauthorize programs to combat tick and vector-borne diseases, and the Uniform Services Leave Parity Act to expand leave for U.S. Public Health Service Commission Corps to be on par with other uniformed services. Also last week, the Senate Homeland Security and Government Affairs Committee advanced legislation to establish a Life Sciences Research Security Board to provide oversight of gain-of-function research. The Bipartisan Risky Research Review Act was approved in an 11-2 vote, with Democratic Senators Andy Kim of New Jersey and Ruben Gallego of Arizona voting no. The oversight panel established by the bill would include 9 members appointed by the president who serve terms of up to 8 years in duration. It would be responsible for reviewing research proposals involving enhanced pathogens with pandemic potential. The legislation, which was reintroduced by Committee Chair Rand Paul, a Republican physician from Kentucky, and Ranking Member Gary Peters, a Democrat from Michigan, was previously advanced by the committee last Congress, but did not receive a Senate floor vote.
For decades, America's healthcare networks have been overdue for a high-tech upgrade, and that's what we're doing. The existing systems are often slow, costly, and incompatible with one another. But with today's announcement, we take a major step to bring healthcare into the digital age, something that is absolutely
Shifting
vital.
to some news from the administration today, where last week, the Centers for Medicare and Medicaid Services hosted a Make Health Tech Great Again event, during which the Trump administration announced commitments by private sector healthcare and information technology firms, including Amazon, Anthropic, Apple, Google, and OpenAI, to support the creation of a patient-centric healthcare ecosystem through interoperability and user-friendly apps. The effort will focus on the promotion of a CMS interoperability framework to enable information sharing between patients and providers and increasing the availability of personalized health tools for patients. The event featured the unveiling of voluntary criteria for trusted, patient-centered, and practical data exchange for all network types. CMS also announced plans to add an app library to Medicare.gov to spotlight trusted, personalized digital health tools. The event followed a May 2025 request for information from CMS and the Assistant Secretary for Technology Policy on ways to modernize the nation's digital health ecosystem, which received nearly 1,400 stakeholder responses. The announcement also coincided with the 60th anniversary of the July 30th, 1965 establishment of the Medicare and Medicaid programs.
Finally, as you all know, the President signed an executive order earlier this year to solve the problem of exorbitant pharmaceutical pricing. According to recent data, the prices that Americans have been paying for brand name drugs are more than 3 times the price other similarly developed nations pay. The President is determined to solve this problem and took further action today. He has signed 17
That was White House Press Secretary Caroline Leavitt announcing that President Donald Trump sent letters to the CEOs of 17 pharmaceutical companies last week, urging them to lower drug prices and work with him to implement his executive order related to his most favored nation drug pricing policy. The president requests the selected pharmaceutical companies to, quote, bring down the prices of prescription drugs in the United States to match the lowest price offered in other developed nations, unquote, within the next 60 days through the following steps. 1. Extending most favored nation pricing to Medicaid for all drugs. 2. Guaranteeing most favored nation pricing for newly launched drugs for Medicare, Medicaid, and commercial payers. 3. Utilizing U.S. trade policy to raise prices internationally for all foreign freeloading nations, that's a quote, and reinvesting revenues directly into lowering prices for American patients. And 4. Participating in direct-to-consumer and or direct-to-business distribution models for high-volume, high-rebate prescription drugs to ensure most favored nation pricing. The letters warn that if companies, quote, refuse to step up, unquote, within this time frame, the administration will, quote, deploy every tool in our arsenal to protect American families from continued abusive drug pricing practices, unquote. Merck, Novo Nordisk, Eli Lilly, AbbVie, Boehringer Ingelheim, Bristol Myers Squibb, Novartis, Gilead Sciences, EMD Serono, Pfizer, AstraZeneca, Amgen, Genentech, Johnson & Johnson, GSK, Regeneron Pharmaceuticals, and Sanofi received letters from the president. Final news today, where the Centers for Disease Control and Prevention has informed outside experts that they will no longer be invited to help review vaccine data and develop recommendations for consideration by the Advisory Committee on Immunization Practices. As a result, liaison organizations will not be allowed to participate in the private deliberations of the ACIP working group process, though they will still be able to participate in the panel's open public meetings. Bloomberg government has reported that the email informing the liaisons of the change characterized the outside groups as biased, quote, based on their constituency and or population that they represent, unquote. Thanks again for tuning into this week's episode of Health on the Hill, brought to you by Heart Health Strategies. For more information on this week's healthcare happenings in the administration and on Capitol Hill, you can visit our website at hhs.com and click on the news section at the top of the page. You can subscribe anywhere you get your podcasts, including Apple Podcasts, Spotify, YouTube, and SoundCloud. Did we miss a story you wanted to hear this week? If so, email me at mduckworth@hhs.com, and we may include it in our next episode. Have a great week, and stay healthy.